Hi, I'm Nurse Teskey, and I'm about to see my patient Wally. He is 68 years old and he appears to be very neat, clean, and well groomed. His eye contact is very inconsistent, especially when approached from the right side. His motor activity is impaired, he cannot walk, and at this time he needs wheelchair mobility supervision, as you can see. He also has right facial droop and his speech is slurred because he has a hard time controlling the muscles used to talk. He has had hypertension for 9 years, a history of ulcers, and he had retinal surgery 6 years ago, but no psychiatric illness history. Hi, Wally. I'm Nurse Teskey. You're at the hospital right now. Can you tell me a little bit about yourself and what happened?
Hi, I'd like to take care of my church, and I have been for 17 years. I lived there in my basement with my wife of 30 years. It is my home where I live with my wife. While I was mopping floors in the church where I work, my right arm, leg, face went numb, and I fell to the floor. My wife found me and brought me here.
Yes, Wally, you suffered a left CVA and basal ganglia hematoma, and now you have right hemiparesis. This means that you had a stroke because one of the arteries in your brain ruptured. Now, the entire right side of your body is weak. Do you feel that?
Oh yes, it's been pretty depressed. I have been pretty depressed because my right arm and leg are useless. I want to cut them off, and I'm not sure if my wife will be able to take care of me when I get home. And I really do not want to go to a nursing home. I am worried we might also have to go on welfare, and I don't want that either. My wife is worried I will have to retire and she will have to move. She loves to cook treats for me, but she feels guilty because I don't take my blood pressure meds and she doesn't force me to. This is all just a lot.
Ah, yes. This type of stroke is usually because of poorly controlled high blood pressure, which is what you have had for 9 years. It is important you take those medications. Is there anything else you've been struggling with?
Well, I lost my stepdaughter to cancer less than a year ago, and it hit us hard. We are still trying to cope.
I'm sorry, Wally. Well, we are going to get you the best care we can. We have the best occupational therapists in the nation, and they are going to do their best to get you back to things you love to do so you can go home to your wife and church. How does that sound?
Sounds like you were crazy.
Wally's formal thought is confused, especially on Mondays when he seems to have forgotten how to transfer, bathe, and dress. His perceptual deficits include visual disturbances, crossing the midline, figure ground difficulties, and severe right neglect. His intellectual deficits include disorientation to place and time and impairment of short-term memory. He is impulsive and lacks safety awareness. His judgment is severely impaired. His insights include slight understanding of his illness and its impact on his future. Cognitively, he can follow two-step commands. His motivation is erratic depending on his mood.
Some occupations that are now difficult for me are speech. Due to my slurred speech after experiencing CVA, I have difficulty finding words. It's difficult for me to be a husband because altering moods due to depression and lack of self-confidence. Due to right hemiparesis, these are now more difficult. Mopping the floors and cleaning the church, wheelchair mobility, walking up steps due to my left leg being flaccid and visual defects, ambulating. He does not currently ambulate due to his right hemiparesis and visual defects. Transferring, my impaired short-term memory loss also impacts my ability to transfer. Bathing, dressing, and